Hi, my name is Kirsten Staff. I am the Programme Director of Pharmacy at the University of South Australia. So I started in pharmacy in 1998 in the UK, and I moved across to Adelaide and the University of South Australia in 2010. The main reason I'm passionate about pharmacy is that it's the idea of underpinning science to help patients, so a patient-focused outcome, but using the scientific principles and scientific methods to get optimal outcomes. The main aim of the Bachelor of Pharmacy is to produce graduate-ready pharmacists who are ready to work with patients and have the appropriate communication skills and problem-solving skills to make sure that patients can use their medicines in the best possible way. So the Bachelor of Pharmacy Honours Programme is a 4-year full-time programme. However, there are options for studying this part-time as well. The programme is offered across both the City East and City West campuses. So there is a mixture of lectures and theory-based courses, but with a strong element of practical skill development and patient communication and problem-solving classes. The key features are the underpinning of science, then moving on to those more patient-focused problem-solving skills and skill development later on, with a strong emphasis on professional placement and real-world industry experience. We receive a lot of questions about the Bachelor of Pharmacy. Let me answer some of those questions now. So the main difference between pharmacy and pharmaceutical sciences is that pharmacy is the pathway to being a pharmacist, whereas pharmaceutical sciences is still doing the underpinning science of learning about how medicines work and what they do, but with a more industry focus. So pharmacists are health professionals that will work with patients, whereas pharmaceutical scientists work in areas of drug design and drug development and drug discovery. So the role of the pharmacist is to ensure that all medicines are being used in the most optimal possible way. Pharmacists work in all areas of healthcare and also the pharmaceutical industry. So pharmacists can typically be found in hospitals, but also in community pharmacies on the high street, but also in regulatory areas and government roles and in other leadership positions. For me, successful pharmacists are the ones who can take very complex and difficult areas and present them in a way that people can understand the science. It's really important that patients and other members of the public are able to understand how they take their medicines to enable them to take them in the best possible way. So the Bachelor of Pharmacy is what we call a taught honours programme. So that means that the honours is embedded within the programme. There are multiple options within the final year. You can have larger research projects, or you can get further experience in clinical areas. But primarily, because of the large options we have for clinical placements, the actual honours element is associated with that extra expectation for the clinical placements. The pharmacy programme at UniSA has a very strong professional placement which is run throughout the final year of our programme. We are unique in that we are the only pharmacy school in the state, which means that we have great opportunities both within the hospital system and across the community pharmacy system across our entire state to offer these opportunities for professional placement. With that, we have very strong connections with the community and very strong connections with our industry partners. All students in the pharmacy programme will undertake a 6-week placement in a community pharmacy setting and a 6-week placement in a hospital pharmacy setting. So to ensure that all students have that experience, we do offer these placements across the state. So some students may have a placement in the metropolitan area, whereas other students may also have the opportunity to experience rural practice as well. The pharmacy programme at UniSA has had significant investment recently into upgrading our facilities. and we now have world-leading spaces for delivering pharmacy practice to ensure that our students are ready to enter the workforce. If you have any other questions about the pharmacy programme, or you would like any more information about studying at the University of South Australia, then please do not hesitate to get in contact with us. We'll see you on campus.